Hi, this is Dr. Antolak from the Gentle Dentist. We're located in Shelby Township, Michigan. The question that I have come in a lot of times with people, especially during this time after COVID, was about pain that people have in their jaws. They have their pain in their muscles. They get headaches. You know, stress is a major indicator of why someone would need a bite guard or an occlusal guard. But I want to get back into a little bit about the causation of why somebody would need. This is actually a bite guard, but it's a part of a treatment, okay? This is only a tool that we have to helping people with their symptoms. Stress, especially when people are sleeping and they feel stressed, many times you go through different sleep cycles in our sleep. We have different levels of sleep. We have REM, we have non-REM sleep. And during some of these processes, there's where people will actually grind their teeth if they have that stress that's provoking them. So usually during the morning, if someone is grinding their teeth at night, they're going to have a number of different symptoms. This is my little friend Scully here, and so I just want to show you a couple things that can happen. The one thing that can happen is you get wear of your teeth. So some indicators of why, something called TMJ, people think, oh, I got TMJ. Well, TMJ is an anatomical location. It's the temporomandibular joint right here. So it's the TMJ. It's right there, okay? And that is a joint. Actually, what they refer to as TMD, temporomandibular dysfunction, okay? So they have a dysfunction in their joint. But that also includes a number of things. They could have an anatomical problem within the jaw joint itself, or they can have a muscle pain. And sometimes they mimic each other and they mask each other. Muscular pain develops and whenever people bite down hard, their muscles here, they clench, all right, so you can get pain here. Also, your temporalis muscle, which is the muscle spreads like this, and that actually creates headaches in the side of the head. So when you wake up in the morning, if you have muscle pain here, you have pain in the side of your head, even in your back of your neck, that can also be all indicated through these muscular pains that you're having, and which can mask as TMJ. Okay, so those are some things that can take place. We use a bite guard like this. It's made here at the office, at the lab, and it's flat plane like this. So what happens when people put it in their mouths, they can grind their teeth, all right? And the wear is on the plastic, not on the teeth. Once you start wearing the teeth down, there's not a lot that we can do to restore that unless we do crowns or we do veneers. Things like that will help to rebuild that bite. But typically, it's inevitable. It's not reversible at that point, okay? Now, so this is part of a treatment of that. We also have other treatments where we use Botox. We can actually reduce the muscle contractions in the face, and we even do what's called trigger point injections, where we can palpate or put pressure on some different muscle groups, which then radiate up into the head, which causes headaches. So it's a very complex process, and it's something that we need to diagnose for that purpose. And so many times, though, if we do diagnose something, we'll recommend a bite guard. To do that diagnosis, we not only go through symptoms of what your past experience has been, but you also have a three-dimensional cone beam scan, which I'll show you next video, which will show the actual anatomical locations of what we look for within the jaw joint itself. So if you have any questions about this, or you know that you're grinding your teeth, you're having headaches, please give us a call at 586-247-3500 or visit our website at thegentledentist.com. Thank you.